Cost transformation and cost management are very two distinct ideas, but they have a lot of overlap. As you know, many healthcare organizations are very concerned with improving their cost structure, increasing their quality and their access. Cost transformation is a broader category than cost reduction. It involves several components, one of which is cost reduction. So cost reduction pretty much focuses on margin improvement. And so what we see there is productivity, revenue enhancements, taking a look at your overhead structure, taking a look at your non-labor components. So that's one aspect of cost transformation. But most importantly, there are other aspects of cost transformation, including business restructuring. And that would look at what your organization offers across a geography or across a business organization as to what makes the most sense for your organization from a services and programs perspective, given the populations that you're taking care of. And then thirdly, cost transformation includes clinical transformation. And what we mean by that is really taking a look at clinical variation across a service or a program. It's taking a look at physician operations. It's taking a look at the efficiency of care that's delivered at a particular organization. So cost transformation is really a cultural change in the organization. It takes many years, very, very hard work. So there are many challenges and success factors that are critical in the approach to cost transformation. The first and most important success factor to cost transformation is executive team and board participation and buy-in. It's a very rough road to pursue one of these engagements, very hard to make these kinds of cultural changes that we're talking about, and you really need to understand that you have the full commitment of your board and your executive staff. The second most important success factor that we have found is really buy-in from the key constituents. So understanding we have multidisciplinary teams working on this kind of engagement and really making sure that everybody has buy-in, they understand the goals and objectives, they know where we're going and how we're getting there. And the third key success factor is really making sure you have good communication. Communication out to your physicians, communication out to employees. So these are really the three success factors we've found as we move through these engagements that are critical to their success. Some of the roadblocks that we found relate to data. Data and benchmarks. You really need to understand the data and the benchmarks and have something that's comparable so you don't get lost in understanding the data, but really use that as a guiding tool to move forward. Secondly, critical to the success is really having good project management. You need to understand these are very, very complex projects. You have to have good management, skill sets, carefully laid out, make sure that everyone's following through accordingly. Thirdly, it's process redesign, right? It's change management. You need to have good change management, good process redesign. Everybody needs to understand where we're going and how we're getting there. And I think lastly, once again, coming back to communication. Communication tools, having the right tools. We find that when we don't have the right tools and when we lack the communication, the projects are not as successful as they might be. So those are some of the key success factors and roadblocks that we've seen along the way.